So why orthobiologics? As we all know, spine pain is a complex condition. A majority of the patients that I see in clinic have already tried and failed multiple standard treatment options. These are patients that are seeking natural alternative treatment options that are non-surgical, that has the potential to improve their condition, restore their injury, tissue injury, and they also wanted to avoid chronic opioid therapy. And so there has been many mechanisms, potential mechanisms of how PRP helps with low back pain that are published in literature. And so I just listed the key ones here, but there's thousands of growth factors that are in our platelets, and they have the ability, or at least have shown the potential for these growth factors to stimulate tissue proliferation, whether it's collagen or myoblasts or myelin sheath or cartilage. It does stimulate the proliferation of extracellular matrix. It modulates inflammation. It does recruit other cells into the damaged tissues. It does have some analgesic effects. And so those are just one of some of the mechanisms by which PRP helps. So ever since the introduction of orthobiologics, with the potential for it to strengthen and repair, there has been a renewed interest in the concept of the functional spine unit, meaning that there are multiple subsystems in the spine that actually creates stability, and then that the spine behaves as a function of all its parts. And so the thinking was that why not treat all the symptomatic structures that contribute to the stability of the spine to have a better outcome. And so we tested this hypothesis, and we published a prospective case series of 46 patients. And this was the first study on using multi-target injection simultaneously on the use of PRP for low back pain. We established some clinical criteria on how to identify the target structures. So it was a personalized treatment based on clinical presentation and imaging studies. And we found that using this approach, patients showed statistically significant improvements in their VAS and disability questionnaire up to 1 year compared to baseline. There was almost a 66% reduction in number of patients that were taking opioid medications, and their satisfaction scores were good to excellent. 82% of them would repeat the injections if necessary, and there was no adverse events with using this approach. So take-home points: chronic low back pain, a complex condition, which can make it challenging to create PRP treatment protocols and standardize the methodologies. So just like any other treatment, it would need a personalized approach, I think especially more so for the spine. Nevertheless, there is increasing evidence of good quality data on the safety and efficacy of autologous PRP for degenerative disc disease, for facet joint, and for radiculopathy. And more high quality studies are needed along with real world evidence in order for us to move the field of orthobiologics forward.